Stroke Awareness Month, and when it comes to stroke, every second counts. 2 million brain cells die every minute during a stroke, and someone in the U.S. suffers one every 30 seconds. Today, Dr. Lucas Clark from St. Alphonsus joins us to share the warning signs, treatment options, and how advanced stroke care is now closer to home right here in the Treasure Valley. So good to see you, Dr. Clark.
Great to see you too. Thanks for having me.
Okay, so let's talk about stroke and the types of stroke and how they're different.
Yeah, I'm glad you asked. So there's 3 different types of stroke. So ischemic strokes account for about 85% of strokes, and they happen when blood flow is blocked to part of the brain, causing that brain tissue to not function properly and eventually die if it's not treated quickly enough. Second is hemorrhagic strokes, which happen when a blood vessel in the brain ruptures because of very high blood pressure. And then that blood leaking out into the brain causes damage to those tissues. And then the third main type I'd like to talk about is transient ischemic attack, which is a TIA. And some people call these mini strokes, but they're basically a small stroke that starts but then stops because either the blood clot breaks apart and blood flow is restored, or patient's blood pressure improves, or their symptoms resolve.
Let's talk about those risk factors, though, for some of these types of strokes. What risk factors are associated with stroke, and are certain people more likely to have a stroke?
Patients that suffer from high blood pressure or high cholesterol, diabetes, atrial fibrillation, sleep apnea, and carotid atherosclerosis are at a lot higher risk. And, you know, we often don't think about that young people could have a stroke, but in many cases, patients come in that have been using drugs like marijuana or methamphetamines or vaping, and it's caused a much higher risk of stroke for those patients.
Let's talk about the signs of stroke, though. What are some of the warning signs? And I know there's an acronym, too, to help us remember those, right?
Yeah, it's called Be Fast.
Okay.
So B stands for balance. So if you notice that you're not able to walk normally, that's a real concerning feature. Eyes, or E stands for eyes, because if you're having double vision or if you notice that you can't see out of part of your vision, that's a clear indication that something may be wrong and that you should get it checked out. F stands for face, so facial drooping or asymmetry or a weakening of the nasal labial fold. A stands for arm, so if your arm is weak compared to the other side. S is for speech, so if your speech is slurred, or if you can't find the words that you want to say, or if you're not able to understand what other people are saying, or you're speaking words that people don't understand, that's concerning for stroke.
Yes.
And then the last letter, T, in FAST, is for time, because it's essential to call 911 and come to the emergency room as fast as possible.
Okay. These symptoms that we just shared, are those like quick onset, or can they slowly occur over time?
Yeah, so actually both can happen. So in some cases, patients will notice that immediately something has happened, they've fallen to the ground and they can't stand anymore. But also sometimes it can come on slowly, just depending on how the mechanism of the stroke is occurring.
So what should somebody do if they suspect that they might be having a stroke?
Time is of the essence. So as you mentioned earlier, time is brain, and the faster that you can get to the hospital, the better. And a lot of people don't realize that it's important to call 911 because the emergency medical services, the ambulance crew, can help facilitate everything so that when the patient arrives at the hospital, the stroke team is ready and waiting to help treat them as soon as they arrive. The reason to come to St. Alphonsus is because we've got a fellowship-trained staff, physicians, inside the neurocritical care unit ready to receive these patients and take care of them. We've just built a state-of-the-art neurointerventional radiology suite, which is a place where they can extract these blood clots that have gone up to the brain and restore blood flow potentially reversing the stroke symptoms as they're happening.
Wow. Oh my goodness. Okay. Where can people go so they can learn more?
I'd recommend they go to stalphonsus.org, or we've also provided a QR code that they can link to it easily.
Wonderful. Dr. Clark, thank you so much. Greatly appreciate it.
Yes, thank you.